In America, morbid obesity is a serious chronic disease that affects more than 25% of adults and 14% of children. And if you're struggling with obesity, it's probably hard to imagine your life differently, but there is hope. Middlesex Hospital Center for Weight Loss Surgery offers an advanced approach through the Da Vinci robotic-assisted gastric bypass surgery. And right now, we're going to meet someone who had the procedure. Take a look at this. This is a picture of Kimberly Zalava, who underwent the surgery about 4 months ago. We are going to take a look at Kimberly now. Wow, Kimberly, congratulations. What an impressive before and after.
Thank you.
You look great. Now, how much weight did you lose?
I lost about 85 pounds.
And you've kept it off. It's been 4 months, and you're maintaining it.
Yes.
Very good. That sounds fantastic. Sit down, join us. Kimberly's joined by Dr. Jonathan Aranow, the medical director at Middlesex Hospital Center for Advanced Surgery. Welcome. Thanks to both of you for being here.
Thank you.
All right, doctor, when we talk about morbid obesity, we're not talking about someone that needs to lose 5 or 10 pounds. What does this mean exactly?
We're talking obesity. The word morbid basically means you're sick because you're heavy.
Okay.
So once you're reaching weights that are in excess of 80 to 100 pounds overweight, we start to see it directly affecting your health and your quality of life.
And what can happen? What are the health risks?
Well, at that level of obesity, we see a 4-fold increase in the incidence of diabetes, high blood pressure, heart disease, sleep apnea, 4-fold increases in cancers like breast cancer and ovarian cancer, colon cancer. And clearly there's a big change in quality of life. What people very often don't realize is the effects on health are so dramatic, it far exceeds the risks that are inherent to surgical treatments.
Okay, let's talk a little bit about the center where you perform the surgeries.
Well, the Center for Weight Loss Surgery at Middlesex Hospital was started, I actually started the program in 2001. Back in that time, there were only 2 or 3 surgeons in the state that actually performed weight loss surgery. Since that time, we've been recognized as a nationally certified center of excellence, and it's a program that has performed well over 2,000 weight loss procedures. I personally have performed over 2,000 weight loss procedures with some of the safest and best outcomes in the state, if not the country.
Let's talk about in more detail the robotic surgical system, the Da Vinci robotic surgical system. What is it exactly?
Well, the Da Vinci robotic system is the next generation of laparoscopic surgery. Laparoscopic surgery is also called minimally invasive surgery, wherein you use small instruments to enter into the abdomen, and through those small little tubes, we have little grasping devices. The Da Vinci system is actually an elaboration of that, wherein these devices now are controlled through a cable pulley type system, where now the grasping devices, suturing devices, are not just claws, but they're actually wrists. They're like miniature hands inside the patient.
Oh, wow.
The surgical console, the surgeon is right by the patient, controlling these instruments with high definition resolution graphics, 3D graphics. It gives an incredible amount of precision and control and visualization of the internal structures. And it's really revolutionary. It's improved patient recovery, it's improved patient outcomes and safety. I can't speak highly enough about it.
And I'm assuming less scarring as well?
It is minimal scarring. It's usually 5 or 6 small, less than half an inch sized incisions. The recovery time, for postoperative pain, the majority of my patients, the day after surgery, they're on Tylenol as their principal pain med. Most patients are back to work within a couple weeks. Some take longer, primarily because of fatigue. It's a very big operation, but with small incisions. So there's minimal pain, but there's a lot of energy going into healing.
Now, Kimberly, I want to ask you, why did you decide to have the surgery?
I decided to have it because I wanted to be healthier for my children, and I wanted to live a long, healthy life.
Sure.
So,
how do you maintain this now? You lost 80 pounds. What do you have to do?
basically, I stay away from anything carbonated. Soda is a no-no.
Okay.
My son gives me soda, and I say, "Oh, Mommy can't drink that." Well, why not? So, but a lot of water.
Exercise, is that?
A lot of exercise.
Okay.
I put him in the stroller. We go for walks. We take the dog for a walk. We have a trampoline.
Oh, good. Well, you're just enjoying yourself. That's great.
Oh, yeah.
Happy to hear that. Doctor, there are some information sessions available to the public.
Yes, we do a general information session. For the bariatric program, I personally present an hour to 2 hour long conversation about what the risks of surgery are, what the outcomes are, what the options are, because there are many different surgeries that are available.
Very good. And all that information is right there on your screen. It's happening November 27th and December 11th from 5:30 to 8 in the North 1 conference room at Middlesex Hospital. More info at middlesexhospital.org and search weight loss. Kimberly, thank you so much for sharing your story. And doctor, thank you so much for being here.
Thank you for having us,
Thank you
Teresa.
for having us.
All right, up next, how yoga changed one man's life and set him on the path to helping others. That's when Style returns. Don't go anywhere.